All right. Good evening, everyone. Let's get started. I'm Sarah Manzi on the ProPlan breeder team. Very excited to welcome cat breeders from across Canada to tonight's webinar, Feline Viruses and Infections. Our speaker, Dr. Liz Ruelle, is one of only a handful of board-certified feline specialists in Canada, and she's the owner and practicing veterinarian at the Wild Rose Cat Clinic of Calgary. Dr. Liz, before we get started, I'd like to ask you a few get-to-know-you questions. Are you ready?
I'm ready for the skill testing questions.
All right. So I know you work with many breeders at the Wild Rose Clinic. What is your favorite part about working with breeders?
I really have to say it's the cats. I always grew up with cats. They are a huge part of my life. My children know that in the pecking order, the cats are a little bit higher on them some days. I like them some days more than my kids. I love my children in the universe, but the cats are really magical. So, and just seeing those kittens that come in, and I think of how many happy childhood memories I have with the cats that I grew up with, knowing that many other families out there are going to hopefully have that same joy.
All right. And then our next question is, uh, so you're based in Calgary. Are you originally from Calgary?
Yes, born and raised. So from Calgary, although I did go to vet school in Eastern Europe, so a little bit of a diverse experience that way. So
So if I was to visit Calgary, what would you say would the top thing you would recommend visiting?
so it's definitely during an Oilers playing games. The Red Mile is quite amazing. Otherwise, I'd say we have a lot of microbrews. There's quite a shockingly number of small breweries around here. So if you've got a good liver and love beer, then Calgary is an amazing place to be.
That sounds like a lot of fun.
As well as gins and other hard liquors too. So
Ah,
yeah.
fantastic. Thank you. All right. So next slide, please. All right, so for our agenda tonight, we're going to start with Dr. Ruelle's presentation, a short message from me about Purina Pro Plan, our breeder program, and then we're going to head into a 15 to 20-minute Q&A. All right, over to you, Dr. Liz.
Okay, well, first, I just want to say a very big thank you, of course, to Purina Pro Plan and the amazing team, especially Alice and, of course, Sarah, for making tonight happen. As Sarah said, I'm on Wild Rose Cat Clinic in Calgary. My clinic motto is here for the love of cats and cat medicine. And I think that really summarizes who I am. As I said, I always had cats growing up. They're a huge part of my life. I love their medicine, but I'm definitely here because I love those kitties. So just a little bit more about me. So like I said, I always had cats. Apple face chocolate point Siamese were the cats I grew up with. So not that veterinarians play favorites, but a pair of beautiful blue eyes does hold a very special spot in my heart. I actually always wanted to be a veterinarian. I wanted to be a horse vet, strangely enough, but then I realized that my arm's not long enough, my not quite tall enough. I like to work in a climate controlled environment. And so I kind of fell into cat practice as a new grad in 2005, and I've never left. And setting that love of cat medicine, I became a specialist in 2012. So I was very blessed and honored to be asked by Alice to do a CE last fall. We talked about like kitten and early kitten socialization, and I touched very briefly in that lecture about herpes viruses. And what struck me was just the number of questions that came out about that infectious disease. And so when asked to come back tonight, I thought, that's obviously a very important area of conversation. And so my goal is really to kind of share current research, some guidelines, treatments, changes that have happened over the last 20 years that I think are relevant to me as a vet and as a pet parent, and of course, applying that to cattery health as well. So here is my current Siamese. As I said, I love a pair of blue eyes, and she's obviously spineless. She really can fold herself in half quite easily. So this is my cat. As she said, she has herpes, as we'll learn that over 90% of cats are carriers for the feline herpes virus. The four viruses or pathogens, I should say, I want to talk about was feline leukemia virus, FIP and feline coronaviruses, herpes, and then finish it off with a parasite, so Trichomonas fetus. So let's jump right into Feluke. So for those unfamiliar with feline leukemia virus, so Feluke is considered a retrovirus. So it is an RNA virus But what's important with RNA virus, with the retrovirus family, is it uses an enzyme called reverse transcriptase to insert itself into that cat's genome. And so once that event happens, then these cats are persistently infected. They're infected for life. And the other retrovirus that will often group together medically with FeLuke is FIV. And so you'll often talk about FeLuke FIV screening kind of going together. FIV, of course, kind of parallels HIV in the human world. So what makes FeLuke an interesting virus is that although these cats, if they've been exposed to it, if that reverse transcriptase gets that virus into the DNA of this cat, if it inserts itself that way, they're now infected for life, but there's a huge range in how that infection translates into the clinical picture. And so we have cats that can test positive, but they be asymptomatic. We talk about a regressive infection case, or positive and symptomatic, which would be progressive. And then because cats really are cats, they can kind of flip flop back in between these two groups depending on their immune health. And as we kind of look at in testing, this can manifest as a cat that tests positive one time, then negative next time we check, depending on how they're feeling in that moment in time. So feline leukemia is a worldwide distribution virus. It's found globally. If we look at tracking studies, so these are studies where labs report numbers of positive cases, we're seeing about a 4 to 6% incident rate across North America. And that number really has come down since the late 80s or since the 80s, all thanks to better testing, so screening these positive cats as well as vaccination protocols. So when we compare FeLuke to FIV, the saying that I use is I give FeLuke to my friends and FIV to my enemies. And so they are both direct contact viruses. So much as how HIV is spread by direct contact in people, these need direct contact with other cats. Whereas we think of FIV would be that virus spread by cat fights, those abscesses, those bites and bite wounds. FeLuke is spread by friends, and this can be cats who are grooming each other, sharing water bowls, food bowls. So that salivary contact is what allows them to spread. Because it's a direct contact virus, this isn't going to linger in the environment. So if I have a FeLuke positive kitty that comes into my clinic, not that I wouldn't wash my hands, but let's say I forgot to wash my hands and I go home and pet my own cat, I'm very confident I'm not bringing virus back home with me because it just doesn't last long enough in the environment for that kind of spread to happen. One of the other quirks with FeLuke, though, is that younger cats, especially kittens, are going to be much more susceptible to infection than older cats. And I had that happen as a case example where a pet parent brought in a 4-year-old cat. He was a rescue, a street kitty. He was FeLuke positive. And he came into this household with 2 other 4-year-old cats. And they had 4 years of mutual grooming, sharing food bowls, all the risk factors. And what was interesting is when we finally realized he was positive because he came sick and we tested his housemates, they stayed negative. And these are cats that had never been vaccinated for it. So older cats, it's a little bit weird, are more resistant to picking up the infection, but it's that kitten group is the group that we really want to be focusing on. So why I want to talk a little bit about FeLuke initially is because maybe a little bit less so now, but there is this kind of separation between what me as a feline practitioner, as a veterinarian, we want to be vaccinating these kittens because this is our at-risk lifestyle, our life stage group. But oftentimes we're coming up against contracts or cautions against the feline leukemia virus, especially where there's limitations that void the contract if it can't be given within that if they vaccinate these cats within that first year of life. And so there's a little bit of kind of a conflict between what we should be doing for these kids to protect them against this virus, to protect that at-risk age group, and what we're seeing kind of in this contract side of things. And so I want to do a little bit of a deeper dive why that was so. And so I hit Google, as all of us do. And in my Google searches, kind of 2 big kind of topics came up. So the first was vaccination side effects. And then the second was the worry that vaccines are causing infection. So when I look at the first one, the vaccine side effects, I will certainly acknowledge that, as magical or as important medically as vaccinations are, there is a very real concern that we can see vaccine responses or reactions, and that's true for any vaccine we give. Now, what always amazes me is I graduated in 2005. I've always went to the vet before that with our family cats, and it's been interesting to see how vaccines have evolved even in my kind of career as a veterinarian. And so we've gone from killed virus vaccines to modified live vaccines, and now this new recombinant technology. And the really neat thing, and I remember those Feline vaccines when I was a new grad, were more likely to cause some tenderness when they were given. We don't see that as much right now. So modern vaccines do seem to be equally effective at giving an immune response, but without as strong a reaction. So that's a big positive for those little kitties, especially those little kittens that we're vaccinating. And so I wonder then in my mind if some of that is residual from these older vaccines. The other kind of concern that came about was that these vaccines are causing infection. And historically, the vaccines were either killed virus or inactivated vaccines. Now we use recombinant. In the case of killed virus vaccine, because there's no living virus within them, it should not happen that we trigger an infection. And then recombinant technology is using parts of virus. So same idea, we're not going to be triggering infection with the vaccinations. But knowing that the more we learn about Feline, the more we see about this whole regressive, progressive kind of flip flop that these cats are going through, it kind of got me wondering if cats that we would have vaccinated for that we thought were negative that became positive and we were blaming the vaccination, if they were actually always positive and they were in that regressive state, and until they told us they were sick, until they told us they had this virus, then that we didn't know it was there, and it was very easy for us to blame the vaccinations as a result of that. So when it comes to the cattery, so what my ideal kind of cattery plan would be is that we do want to screen any new additions for both yarn leukemia and FIV. Ideally, we do want to retest them in 60 days, and I'll explain why in a slide in an upcoming slide. Regardless of whether whether you as a cattery owner chooses to vaccinate against Feline in this kitten group, I just want to see that prohibition happen. We want to encourage these vaccinations at this at-risk group, and so I would love to see that barrier be removed for me. And as I always tell all of my patients, we're always going to adjust vaccine protocols to fit the lifestyle of that cat. Kittens to me are really kind of unknown elements. I might think my cat should be an indoor kitty. The cat might have another idea. The cat might be an absolute escape artist. Utini, my wonderful smart cat that I love, she's very good at jimmying open the back door if my kids don't latch it all the way. And so even though I do everything I can to keep her in an indoor lifestyle, she's trying to tell me she wants some outdoor access, and we have a little bit of arguments to that effect. So I do protect appropriately, but I will always adjust it based on how lifestyle is changing. So when I talked about that testing idea, so if we're testing for Feline, can I put the differences between Feline and FIV on this slide? So in the case of feline leukemia, our tests are antigen-based. We're actually looking for active virus. This is in contrast to FIV, where we're looking for antibodies. So we're looking for two different things. And so if I have a positive test result, then in the case of Feline, that tells me this cat has enough virus present in the blood sample to trigger a positive test result. And in the case of FIV, it's more there's enough antibodies, so I've had enough of an immune response to trigger that positive. In both cases, or in the cases of FIV, we are more likely to see a false positive. So a false positive being where my cat is testing positive when it's supposed to be negative. And this would be in cases of if the queen were a positive carrier to FIV and she was passing on maternal antibodies to her kittens, or in Australia, they still have an FIV vaccine commercially available. There was an FIV vaccine in North America, but that's been pulled off the market. gosh, I want to say for at least 15 years now, so not likely to be relevant in the cattery situation. But if we have an Australian sourced cat, then they could still test positive to vaccination. In the case of Feline, because I'm looking for that active virus in the system, a false positive is going to be unlikely. And my first suspicion, if I have a positive cat, I'm always doing a confirmation test just in case it is a bad test. In the case of false negative, so this is where my cat does have these infections present, but the test results are coming up negative. It's usually going to be a scenario in the case of FELV or FELUC if we just haven't had enough time for the virus to replicate enough. So if this is where if my cat is exposed to the virus today and I test them tomorrow, the virus just hasn't had enough time to build up in the blood levels to give me a true picture of what's going to happen. And similar for FIV, if I get infected today, my immune system is lagging behind. So that's where these false negatives can happen. And that's where the recommendation was that we'd want to recheck 60 days later to make sure we've given enough time for the virus to surface, to announce itself, or the immune system to be like, whoa, got to make some antibodies and have that. With VLUC, we can see a false negative in the case where if I have a really good immune system and it's suppressing that virus replication to almost undetectable levels, and these can be these cats that test positive one time, negative the next, positive 3 months later when they got a cold, negative again. So that's that regressive, progressive idea, which makes VLUC a little bit quirky. So that's kind of Felix. So again, bottom line is screen everyone in the cattery, especially any new additions, and let us vaccinate these little kittens because that is our at-risk age group. So jumping to the next viral agent, we've got coronaviruses. And I mean, coronaviruses sadly have really been, I think, the bane of all of our existence for the last couple of years, as we know, they're involved in many, many species. So coronaviruses are an enveloped RNA virus. Why I always remember that is because you'd think the envelope should protect it, but it doesn't. These are actually very easy to disinfect viruses. So yay, we can kill them with routine hand washing, routine disinfection within our clinic or cattery or home settings. But because it's an RNA viruses are really prone to mutation. And we kind of saw that with COVID, where it was all these different strains coming out all the time in the media. And I was like, well, that was always going to happen. RNA viruses love to mutate. And that's the problem with them, both from developing vaccinations. And in the case that we see with coronaviruses, fecal coronaviruses and FIP, why it becomes a big problem in the cat world. So feline coronaviruses, and it's important we have to distinguish between two different types. So we have feline fecal coronavirus, which I've abbreviated as the FECOV version. This is a viral pathogen, it's worldwide. And this fecal coronavirus just lives in the kitten tummies. They live in those intestinal tracts, and they tend to cause diarrhea. And the challenge we have is that the exposure will cause this viral shedding, sometimes weeks to months. And if we are in a household, especially where there's more than 5 cats, then we can reinfect these guys. So even though they can clear the virus for a little bit, reinfection is very, very common. And so clearance is almost impossible when we start to have too many cats in the home environment. Because it's highly contagious and because of that mutational abilities, it can reinfect quite easily. If we look at kind of infection rates, it's very common. 25 to 40% of household cats will have it, but almost up to 100% if we're looking at shelter studies and kind of colony groups as well. And I can certainly attest to that when I look at fecal pathogens, do diarrhea PCR. You know, a lot of these kitties are testing positives more often than not. So then we're going to talk about FIP, and this is where it gets a little more, I guess, complicated, and it's taken me years to wrap this around my own brain. So FIP, or feline infectious peritonitis, is still an infectious disease. It is caused by coronaviruses, but unlike that fecal version of it, FIP is not communicable the way we would traditionally think of infections are. So FIP in itself is caused by a spontaneous mutation within that kitten or that cat's digestive system. So we have these cats, they're persistently having this gut form of coronavirus. Their immune system can't clear it. The virus is replicating in high numbers. And we eventually have this rotten luck mutation happens where the pathogen, the virus can then gain access to the macrophages, can kind of hijack my whole body immune system, and then it goes systemic, and that's when we actually would diagnose FIP. So it's a weird concept where, yes, FIP is infectious, but it is not a communicable infectious disease. We theorize that every case of FIP is due to a spontaneous mutation. It's maybe very kind of predictable and consistent mutation that allows the virus to gain access to the macrophages, but it's happening within that individual cat. So clinically, FIP, if we have the wet form, it's that kind of classic effusion. So here's an x-ray of a 12-week-old kitten. He came in for weight loss. He was having some diarrhea. And we can really kind of see how, like, he's got no muscle, like his spine, there's no kind of muscle layer covering his spine. And we've got this kind of bloaty belly. So on my x-ray, gases are black, and anything that are solid are varying shades of gray to white. So we can kind of see that little R is just my x-ray tag there at the bottom. So the metal is shining out quite brightly. So all of that white in the belly is fluid, and all that black is just very, very empty, gassy guts, because, you know, he's sick. They're not going to be, they're not eating, they're gassy and gross. So this is that very kind of classic x-ray appearance. We've got a bloated tummy, we've got a little muscle wasted kitten. And if we were to examine that fluid, it's going to have a classic straw yellow, high protein kind of nature to it. So the wet form is kind of fairly straightforward to get our diagnosis. And this fluid is just all his viruses, these antibodies, these antigens kind of in these effusions. The dry form of FIP is a little bit more tricky. So this is where my immune system is maybe strong enough to kind of keep the virus in line, but not really. And so we often will see like failure to thrive. So these might be kittens that are not thriving very well. On ultrasound, we might see some like little kind of granular lesions, so almost like little virus pockets or infection pockets within these different organs. And so the dry form especially becomes a little bit more of a diagnostic challenge because we diagnose FIP kind of all these puzzle pieces. So age of the kitty, is there fluid, is there not fluid, is there granular lesions, is there not granular lesions? Do we have high globulins reflecting the antibody response? Or is there anemia? Historically, we may have added looking at coronavirus titers, but we don't really do that as much anymore because so many cats have the fecal version that a positive titer doesn't actually tell us a lot more information unless we're looking at multiple titers over time. So then we have to ask the question, well, what are the risk factors for developing FIP, and are some breeds at higher risk? So I want to say that in my practice, you know, I can go a year or two without seeing FIP, and then all of a sudden I've had 3 kittens that were all from the same rescue and 2 litter mates within the last couple of months. So it is very sporadic. And usually all the cats I've seen are typically shelter cats or domestic short hairs. So no fancy breeds have at least flagged in my clinical experience. But I would make the argument that given our immune system, a big part of it comes from our genetics. So the Tom, the Queen, they're presenting or giving us a lot of our immune system kind of base complexes or base part of it, that this could be where we might see certain breeds or breed lines being more prone to throwing FIP just because their immune system is not strong enough of a cellular immunity to kind of clear the virus. So in the catteries, so what I want to kind of argue is that I think getting rid of coronavirus is going to be near impossible. We just can't disinfect enough. We can't depopulate our cats enough. It's just not going to happen. It is not realistic. It is not something I would ever ask or work to try and achieve because I think it's impossible. Instead, what I would say is our goal becomes limiting viral shed. That's a very realistic goal. And so if I can limit the shed, kind of hopefully break some of these cycles of reinfection. So how can I do that? So the ISFM, which is the International Kind Care Cat Care Group, it's based off of the American Association of Feline Practitioners. It's kind of the international uh, association. They ideally want to have cat groups no more than 4. Now, I appreciate that probably is not going to work in a cattery situation, but just kind of being aware that the more cats we have together or housed in the same environment, sharing litter boxes, could be reinfecting each other. Increasing those litter boxes, make sure that they're easy to access, easy to disinfect. Again, I'm not thinking this might be something as applicable in a cattery where, you can now see some of those fancy kind of like litter boxes that look like furniture or hide into furniture. Those look fantastic aesthetically. So those might work really well in a home environment, but not necessarily practical for disinfection. So that one isn't necessarily I'd reach for. And then it's just that cleaning, disinfection, being mindful of that. It's reducing that viral load in the environment, kind of much in the same way that we tackled COVID in people. If we are dealing with, so other ways we can kind of limit kind of shed would be if we do have queen and kittens, limit their access to other cats. Again, making sure just normal disinfection. So if visitors are coming to play with the kittens for that socialization, hand washing is very important, and not maybe mingling kind of those groups as much. And then how we can limit the stress on these queens, especially, and these kittens, because stress is a known immunosuppressant agent. So that comes to, again, getting the queen set up in her little cattery box before the kittens are born, making sure that we have compatible cat groups together. If we look at cat colonies, usually it's mother-daughter pairs or sibling or sister pairs. So cats do, for a certain amount, don't mind other queens in their environment, but we want to make sure they are going to be compatible with who they're associated with. So what about kind of testing? So we certainly can look at checking feces of these kitties. Usually from my side, I want to look more at the fecal matter for like trichomonas as we talk about that parasite. Certainly we can determine, is a cat shedding? Are they an active shedder? Be aware that even if we have an active shedder, it might be different to clear it from the cattery situation. But if I do say have a positive shedder, that I'm bringing a new cat, a new queen, a new tom into my cattery, then if that cat is positive, then I'm going to want to limit his exposure or her exposure to the rest of my cats in the cattery. And I'm going to kind of maybe step up my disinfection protocols towards that cat's where that cat's being housed to kind of limit the spread to the rest of the cats. One feature of PCR, which is new, is something called quantitative PCR. So PCR, or polymerase chain reaction, is a way to say, is something, in this case, is there evidence of the virus, yes or no? And that's your classic PCR. Quantitative PCR not only answers the yes/no question, but it also gives us the answer of, are you a high or a low shedder? So am I in active state of infection, or maybe it's resolving? And again, that information might be relevant towards, okay, we're on a low shedder, we're on the right track. I have a high shedder, increased disinfection, not going to kind of introduce him or her to the other kitties. And if we are seeing cases, so let's say within our cattery, we are having, an increase of FIP cases, then if I was to troubleshoot that within my clinic, with my cat, with my breeders, I'm going to try and look for other reasons why there might be some immunosuppression. So are there some cat conflicts? So we have to kind of reorganize the housing strategies. Again, like if it's a consistent Tom Queen pair that is giving us these FIP positive kittens, then it's not that that Tom and that Queen is bad. It's just that whoever their immune genetics are when they mingle together, it's not throwing a strong enough cellular immunity component, so that combination of parents might not work. So that could be where, picking a different Tom for that Queen or vice versa. And then the final thing would be, are there high shedders? Like, how do we reduce that viral load? Is there anyone who's just kind of just driving that infection cycle. So with FIP, so I have seen not as much now anymore, but on some breeder contracts in the past that FIP vaccines are prohibited. So again, it avoids these contracts. I would say it's a moot point. As far as I'm aware, there is no licensed vaccine against FIP in Canada. There was one when I was a new grad. There is not anymore. And regardless of even if there was one available, like I'm not going to reach for it. From what we now know with FIP, these vaccines are not likely to be effective. Usually they are not indicated for cats younger than 16 weeks of age, and most of these cats are going to become infected at this point. So there is very little value of FIP vaccines. So even if that were a point of something that we wanted to do, I'm not going to reach for it. It is just of no value from a cat perspective. So one thing that really has made me excited, especially in the last year or so, is new treatment for FIP. So when I was a brand new baby doctor, if I had a positive cat or kitten, it was a hard conversation. I could offer band-aid solutions of supportive care, antibiotics, steroids to try and help reduce that kind of fluid burden in those kittens. But ultimately, euthanasia was all I could offer as treatment. And so back in 2018, UC Davis out of California really gave us some hope, and they were testing an antiviral drug, which is GS-441524, and they were actually seeing cure in wet form FIP cats. So it was an absolute miracle when these first studies came out. Now with COVID in people, remdesivir or GS5734 is a potent antiviral used in people. And we're now seeing that to be also effective at managing FIP in cats. And so it's very exciting because I actually can now potentially offer, these pet parents, my cat parents, a cure for FIP, which, if you'd asked me that when I was a new doctor, I would have said impossible. I've always said if I hoped anything came out of COVID, it was going to be better coronavirus treatments for cats. And it looks like that is the silver lining out of the pandemic. One of the current stumbling blocks, which a lot of Canadian vets are working on, is that these drugs are licensed in the UK and Australia. Just in the last couple of weeks, the Health Canada has allowed us to do EDRs or emergency drug releases to gain access to these drugs and import them from these countries. So I hope that these are all these baby steps that will allow us to get our hands on these drugs, and as they become easier to access, more affordable as well. FIP is going to be a very different conversation than it used to be, and that is so happy. That makes me just so excited to be able to do that. So jumping to our third virus, herpes viruses, FHV1, my goodness. So that was the one I talked about in that initial fall lecture, because I assume every cat walking into my clinic has herpes. What a great conversation that, hi, I'm Dr. Liz, your cat has herpes. Let's all talk about chlamydia and mycoplasmas in cats and discuss what they're doing on a Friday night. Just kidding, obviously, they're not getting into any kind of mischievous behavior the way we think of herpes are in people, but it's an interesting and fun conversation. So feline herpes viruses, over 90% of cats are carriers. What I always have to clarify with owners is that these are the cat versions of herpes viruses. So I can give all these cats kisses to my heart's content. I have certainly been sneezed on at various times in my career, and I have very little worry that I will catch feline herpes virus. So keep giving those kisses. When we think about the clinical signs of the virus, so herpes, much as like people that get cold sores or herpes viruses in people, this is a disease that once you're infected for life. And the clinical signs can manifest or wax and wane based on how your immune system is doing and what your stress levels are. So much in the same way that we may only get a cold sore when we're under a lot of stress, or shingles, which is the herpes manifestation of chickenpox, which is also herpes virus, comes about as we get older, a little bit more immunosuppressed, or when we're under a physiologic stress. That's when this virus likes to kind of rear its ugly head. Clinically, we've got that classic signs that's a cold, runny eyes, runny nose, some sneezing. Typically, we don't see, or I don't really associate fever with herpes virus. If I have a kitten coming in with cold signs and a fever, I'm usually either thinking of the calicivirus or herpes with added bacterial infection, so something else kind of on top of it. But it's really that kind of thing when we have a head cold, it's we're congested, we've got discharge, but we don't typically have a fever unless it's a more serious manifestation. So what about in the cattery? So I'm going to assume most of your kitties have herpes, and that is okay. Every cat does. So what about testing for it? So we can do PCR on feline herpes virus, but the challenge we have is that if we don't get deep enough tissue swabs, if we're not actively showing signs, then false positive or false negatives are likely to happen. And at the end of the day, it's just not where I would put your money towards testing. So it's, I think, a very kind of limited diagnostic value in that sense. So instead, I'm going to say, well, let's presume all these cats have herpes. We're going to prevent it or limit shed. And that's been my goal of trying to stop these cycles from happening. And the goal from that is reducing stress within that cattery environment. From the queen passing on to the kittens is kind of our goal that way. So some of the ways that we can do that is isolating the queen. So we want to take her into her little kind of nesting box a few weeks postpartum so that she's in a very minimal stress environment. So when she has those baby kitties, she's going to be less likely to be viral shedding. In the multi-cat cattery situation, we want to make sure these cats have adequate resources. And resources include things like food bowls, water bowls, litter boxes, perches, even laps and cuddle time. It's like everyone needs those resources in their lives to thrive. And if we do have not enough of them, say not enough food bowls, there's food competition, litter box guarding, then for the cat that may be lower on the pecking order, that could be a very stressful situation, and that might cause them to be active herpes virus shedders, which is then exposing the rest of the cats in the cattery to that increased viral load. And then if I'm thinking of my housing situations, it's just finding cats that get along and like each other. So again, just finding those housemates that coexist quite comfortably to minimize that stress on them. So what about managing it? So let's say we do have a herpes outbreak in the cattery. Well, how am I going to kind of treat that? So there's kind of 4 different tools that I have in my toolbox, and I like some more than others. So the first thing I'm talking about is lysine, and lysine was always kind of the go-to I got taught 20 years ago. And lysine is just an amino acid, so it's a protein, glorified protein powder is what we're feeding with lysine. And the goal behind lysine is it's going to boot out arginine from the virus's replication pathway. So my goal is that I'm going to slow down that virus to give my immune system a chance to kind of rein it back in and get it back under control. As a supplement, it's going to be very easily sourced. Of course, it's safe. It's just a protein powder, it's an amino acid. So from exposure for breeding animals, queens, kittens, we have that safety behind it. One of the challenges we have, and this is coming out of some shelter studies, that maybe found lysine to be not as effective as a way to manage herpes as we used to think. And I think it's because we have to have the cat eat enough in that moment to make it effective. And so that traditional kind of bulk sprinkle of lysine on the cat food that they kind of graze over hours and hours wasn't actually the right strategy. The dose is usually 250 milligrams for kittens, 500 milligrams for cats twice a day. You have to eat that all in that moment to make this kind of work. And so that's the kind of stumble there is inadequate dosing or like over that period of time. So what about probiotics? And I kind of group this into my immune system boosters. And so as we kind of alluded to, herpes is looking for that immunosuppression. It's looking for us to be under physiologic stress to, I'm going to flare up and kind of, exasperate your stress by having a cold sore, in the case of a kitten having a runny eye, runny nose, and some sneezes. And so probiotics, I think, are a very intriguing way to manage herpes. And it's basing it off the concept that my digestive tract, my gut flora, plays a really, really big role in my immune system. So when I think about probiotics, they have a lot of different roles. And I use the like Activia line as a good example of this. And so if I think about it, if I go to my yogurt aisle and I've got those little Activia little yogurt pots, and if I watch those commercials, they're going to give you that little like belly dancer belly. So these particular bacteria might be gut colonizers. They're going to work within my digestive tract to improve my intestinal health. And that's a bifido strain within that Activia product. I can also go that same yogurt aisle and get little drinkable ones. They're those little yellow bottles, which is an Aminocasei immunoregularis bacterium. And that label claim is to boost my immune system. So here's two different yogurt products, two different different probiotics within these yogurt supplements that have very different kind of label claims. And that's just to really, I use that as an example to highlight how probiotics, it's not, we have to pick which one we're reaching for, because probiotics in themselves have lots of different roles. And I could reach for a probiotic that's going to boost my gut health, but it might not have any role in improving my immune system or improving my immune health. And so, sure, I might end up having a cat with perfect poops, but they might still have their herpes actively showing. So Enterococcus faecium, which is the active probiotic in Fortiflora, I love this one just because it has the most research behind it. Dr. Mike Lappin is kind of the wonderful cat guru there who's done the probiotic versus lysine studies in shelters. And he's been shown that this one does boost the immune system at the gut level. And this is what I reach for more than anything else for a simple herpes case. Part of the reason being that unlike the lysine, that little sprinkle in the food really can make a difference. And I love Fortiflora just because it's so palatable. So when you have those kittens that have those really, really bad colds and are a little bit off their food because they are congested, they can't smell as much, they just need to be able to smell that deliciousness. And in that case, the flavoring agent is phenomenal. So that's why I put Fortiflora as a picture. And I would recommend Fortiflora, even if Purina wasn't the one sponsoring the study. That is my go-to probiotic for herpes viruses because it has the Enterococcus faecium, has the research behind it, and the palatability can't be beat for those sick kitties. So what other tools do I have? So vaccination. So we do vaccinate against herpes virus. It is part of our core vaccine protocols. I always kind of think of it more like a shingles vaccine in people. So I'm not going to be able to clear the herpes from the body, just as the shingles vaccine will not remove the original chickenpox virus from my body. But the goal is that if we are sick, we're going to have a less kind of frequent flare-ups. And then I did throw on antiviral drugs. Yeah, I do reach for them on occasion. They're usually not my first kind of go-to strategy. Some antivirals are toxic to cats. We have to be very careful which ones we're picking. Dosing is a little bit kind of weird. And much as in people, if we do reach for an antiviral drug, it's just going to help suppress the virus. It cannot clear it. So if I have a really severe infection, then yes, I can try and help resuppress the virus to allow the body to overcome it. But cure is not going to be feasible, and cure is not feasible with any of these strategies. So again, kind of summary for the cattery. So testing, yeah, I always am happy to spend other people's money, but I think there's more relevant places to spend it than proving if your kitties have herpes or not, just because those negatives do not always mean negative. And because of that, in my cattery, it's like I said, being a herpes-free cattery is likely unrealistic. So my goal is now just being with kids as healthy as we can, limiting that viral shed. We're going to focus on that husbandry. We're going to limit that kind of queen stress. If I do have outbreaks, supplements like lysine, probiotics to reduce that kind of viral load in the environment or to help boost the immune system are my go-to. And as I said back in the fall, herpes is not the reason why these kittens should not be socialized. So they need to be cuddled and exposed to people to make wonderful companions in the home. And so herpes is not going to be the reason why these cats should not be getting lots of people loving them. So that's kind of all on the virus side. I just have kind of a little bit of a final kind of comments. So just to kind of recap, so herpes and feline, if they are fragile, they're not going to survive the host for a few hours. Coronaviruses are moderately stable, but thankfully very easy. All three of them are very easy to disinfect. So routine disinfection, nothing fancy needed here. we can kill these viruses or limit their viral load in our environments, which is the really good news for all three of them. So disinfect away. And if you're my children, I'd say wash your hands too. So leaving the viruses, the last pathogen I want to talk about was Trichomonas. So Tritric is kind of neat. It's a relatively new pathogen in our little cat world. And for years, it probably was considered this like non-responsive Giardia. And it's only been around since about the 2000s, so it was found about 20-ish years ago or so. And the challenge we have is that these parasites look near identical under the microscope, those little kind of rackets with tentacles. And I think it kind of comes down to one has very random motion, and the other one's a falling leaf motion when you're looking at that fecal sample. So, cool, that is how identical they kind of look. Now that said, they do like to play nice together, so we can see co-infection. So Tritric and Giardia can be found in the same kidney or same kind of stool sample. Clinically, this is going to cause large bowel diarrhea, and like the other three viruses, it is also a worldwide pathogen as well. So this is not exclusive anywhere in the world or excluded anywhere in the world. So one of the things that has really made a difference here is PCR. So the challenge with Trichomonas, and probably why it got missed for so many years or misidentified for so many years, is unlike Giardia. So Giardia has its little kind of tennis racket protozoal form that we can see in that fresh fecal sample. And then when the cats defecate and it's in the feces itself, it forms this kind of cyst. It sporulates. It has this dormant form. So on a fecal sample that was a little bit older, we can still identify Giardia because we can see that cyst. Tritric doesn't have a cystic form or that cyst form. So unless the sample is fresh, and it says usually like so fresh, it's like I joke with the cats, like poop on my microscope. Hopefully not, but that's how fresh you want it to be. We can miss this parasite because there is no other form apart from that live one to kind of identify, at least in like the simple clinic setting. So as I said, PCR really has changed our diagnostic landscape for the better. PCR is highly sensitive, highly specific. It has a sensitivity of 95%, so we're really going to be able to catch these kitties. And if we compare that to culturing of feces, where we only had about a 55 to 80% sensitivity. So PCR allows us to diagnose this pathogen with much greater ease than ever before, and so we're able to kind of catch them. So in the cattery, so 2001, so Dr. Jody Gukin, she's kind of like the Tritric guru. She's the one that discovered this parasite. And so her research, say back in 2001, found prevalence quite common, 31% of cats at a cat show. And these are not necessarily cats that were having large bowel diarrhea. She just looked at a whole bunch of fecal samples, and 30% of these kitties tested positive. What Dr. Gukin has found is that we can see resolution of the diarrhea. So kind of like imagine you're trying with these like non-responsive Giardias, and then magically at about the age of 2, all of a sudden the body figures out how to coexist with it. We see a spontaneous resolution of the diarrhea. And we thought, yay, problem solved. But what we now realize is that these cats are actually going to be most likely to be persistently infected. So we have no clinical signs of diarrhea, but they're carriers. And this is going to be a really big problem in my cattery, where if I bring that asymptomatic carrier into my cattery environment, and then all of a sudden we're going to be sending home kittens that are blowing with large bowel diarrhea. So we have our like little mothership of infection, but they're not showing us signs because that would make life way too easy. So my goal here is really going to be preventing Tritric within the cattery. So we're going to want to screen any new cat before they get introduced to the rest of the cats. And that's going to be that PCR. And I will say, though, if you do have a positive Tom or Queen, I recognize that you are picking the Toms, the Queens. You're picking for their genetic lines for the betterment of the breeds. Just because they have Tritric doesn't mean we want to lose their amazingness. And so if we do happen to have a positive, that's okay. We're going to limit that exposure to the rest of the cats. We're not going to spread Tritric everywhere. We're going to kind of limit them, and we're going to be able to treat them and hope that they do respond well to the treatment, and then we're going to keep them separated until that PCR is clear. So how do we treat tri-trick? So this is still not as awesome as I'd want it to be. Ronidazole, which was originally a Turkey drug, it's kind of in the same family as metronidazole, but it's ronidazole, is still our kind of go-to treatment. It can be impact our health, so certainly use caution, wear gloves if you are administering it within your cattery. We really can't use it in pregnant nursing queens and of course kittens. So we're a lot of luck there if they are positive. The biggest worry is that we can see cats go neurological on the drug. If there's any neurological signs, we do have to stop treatment. Um, Compared to other drugs of this class, like metronidazole, where there's a little bit bigger safety range, ronidazole has a really tight safety range, so we have to be watching for those side effects. And then the other frustration is that no drug is foolproof. We certainly can see treatment failure. Typically, I'll treat twice, and if we're still positive afterwards, I just don't have a backup plan. So I do have that frustration with that regard that we can see failure, and I don't have an easy solution for that part. So, kind of as my final thoughts, if you carried me through this far on this amazing infectious disease journey, so this is kind of, I guess, what my goal and my message of tonight really is I'm not expecting us to be able to clear certain infectious diseases within the category. So herpes, coronaviruses, I can't get rid of those. I have no expectation as a cat practitioner, veterinarian, for us to be able to clear them. So we're going to work to minimize their impact on those cats in our cattery. We're going to look at disinfection, minimizing stress, boosting those immune systems to ensure that our kittens are going home healthy and as low shedders of these two agents as possible. Now, for the cases of Feline and tri-trick, I think we really can prevent. We can have the screening is available. We do have treatment available in the case of tritrichomonas. And I really want to, my goal working with breeders is these pathogens, these two don't end up in the category in the first place. Or if in the case of tri-trick, we're preemptively checking so that we're not exposing everyone else in the category to these agents until we can manage it. And then the final kind of comment I'm going to make, more addressing that Feluke aspect, is, vaccine protocols certainly have changed. There's a lot of new data. I mean, I remember, the goal was always vaccine every year for everything. We don't do that anymore. The recommendation is always to tailor it to lifestyle. Certainly, we are very aware in the case of Feluke, kittens are the at-risk group, so I really do want to see those little guys getting protected. But that we need to kind of update our recommendations and the category recommendations because the vaccine landscape is very, very different from where it was even as low as 20 years ago. Not that I want to acknowledge I'm an old veterinarian, but it's been pretty cool changes. So there is my wonderful Lucini. She loves boxes, and she's got the glorious cross-eyedness of the Siamese. So that is everything from my side, and I would pass it over to Sarah for questions, and thank you. Hopefully everyone found that informative. Yeah.
Dr. Liz, thank you. That was fascinating. All right, don't go anywhere yet. We still have Q&As, so if you've got your Q&As, drop them in the Q&A box. But before that, I'm going to take a few minutes, I promise, to highlight a few veterinary recommended pro plan cat food products that are popular with breeders, as well as tell you a bit about our breeder program. All right, next slide. All right, so we have ProPlan offers advanced nutrition that support immune health with ingredients including antioxidants for immune system support and guaranteed live probiotics for digestive and immune health. So we have kitten formula, of course, very popular. They're also suitable for queens during all stages of reproduction, high in DHA, high protein at 42%, omega-3 and 6, calcium, includes live probiotics. This product graduates to the adult complete essential lineup, which is a great everyday formula and comes in several different protein options. Next up, the indoor hairball formula shown here is great for long hair breeds. It includes natural fiber and helps control hairballs. And the high protein maintains lean muscle and healthy weight for breeds that tend to put on weight more easily. And then our third up here is the urinary, often recommended for intact males. The low dietary magnesium reduces urinary pH. Next slide, please. So we have new ProPlan Vital Systems. ProPlan cat food that's packed with antioxidants for a healthy immune system. Gives your cat digestive health support with prebiotic fiber. Comes in real salmon and chicken formulas featuring high protein to support muscle and heart health. And cat kibble with choline support brain function. ProPlan is sold through specialty pet stores like PetSmart, Wren's, Pet Value, local farm and feed stores, as well as online retailers. Next slide, please. So new calming care for felines. It's a proprietary use of probiotic strain BL999 to help cats maintain calm behavior. It helps promote positive behaviors such as playing and seeking out social contact. Supports cats during external stressors such as changes in routine and location. Next slide, please. All right, so here you can see some of the savings on different items for our breeder program, just so you can view. And then next slide goes over our breeder program. So we have great savings on every purchase of ProPlan, so $10 off every large bag. We have free delivery for large purchases currently in Ontario only. And we have excellent breeder kitten kits with a bag of kitten food for free small bag, valued of $38. Coupons for 3 free tins of wet food, and then $10 off your next bag of food. And then new this year, we include a box of Fortiflora for each kitten to go home with, as well as 1 free box of Fortiflora for the breeder as well. If when registered for this webinar, you signed up to hear from a ProPlan breeder representative, that will be me, and I'll be following up with you this week. So look out for an email, or to learn more, please visit purina.ca/proclub. All right, so we're gonna move on to our Q&A. All right. So just a reminder, we'd like to ask you to keep your questions general versus to one of your cats. So please take a moment to notice the difference between the two boxes, Q&A and chat. We'll be pulling straight from the Q&A box. All right, so let me just open that up. All right, so our first question is from Joanna, and their question is, what is the best way to verify if your cat or kitten is suffering from FIP dry? FIP liquid is very easy to discover, being they have large bellies of liquid. Unfortunately, there's no test. So what would be the best way to evaluate? And would you do a complete chemistry of blood? What would the results help? Better to know if your cat may have dry FIP. And what, in your opinion, about the new treatment given to cat orally or by injection for 82 days?
Okay, so great question. And I would say that, feline practitioners, we do struggle with diagnosing the dry form of FIP. Recently published AAFP guidelines to try and help improve that diagnostic landscape. So we'll talk about historically it was always like nails in a coffin or like bricks in a wall of supportive evidence. So we would want to take a cat that has that failure to thrive, so that muscle wasting, potentially intermittent diarrhea, and then look at on blood work, is there evidence for anemia? Is there evidence for high blood globulins, changes in bilirubin? So fairly non-specific, but we're going to look for that proof that yes, this is a failure to thrive case. On ultrasound, we can look for granular lesions. I know within my own practice, we had a kitty that was a failure to thrive that we went so far as to do intestinal biopsies, and even going to that relatively extreme step, even looking at trying to prove the presence of virus within the tissues itself. It wasn't such a straightforward. Even the pathologists were kind of stumbling on a commitment to that point. So it is tricky. So we look at that kind of bodies of evidence, excluding as many other diseases as we can, and kind of what are we left with within our disease pool. Now, I have heard rumbles out of my colleagues from Australia that one of their ways that they are trying to prove dry form FIP is actually treat for, I want to say it was 5 days, but treat for a fairly short period of time with the antiviral drugs. If we look at the data out of UC Davis, it was miraculous how like they had wet form FIP cats, which I would argue is the more serious presentation compared to dry form, where we were seeing those effusions resolve. And I've seen that within my own practice, where we'll have cats that start the drugs and within 2 days, 3 days, the effusions are gone. Clinically, they're feeling better. And so in Australia, what they're doing is they're actually putting these suspected dry form FIP cats on a very short course of antiviral drugs to see, do we see that improvement in clinical signs, on the premise that if it wasn't a coronavirus-based disease, we would not have that positive response. Now, obviously, we're not there yet in Canada with the EDRs and even just giving me access to the drugs. But I said it was a very interesting approach of in Australia, where there's doing treat first to then see if treatment supports your diagnosis. As for like the treatment courses, the 82 days. So this is, I think, to me, very, very new ground. And being on some email threads and some Zoom calls among some of the, like Dr. Scott Leese, kind of the infectious gurus within Canada, I think we're going to see the treatment protocol landscape change over time. Was it once a day versus twice a day? Even discussions among the injectable, the GS, it was the 44154 is the injectable version. Then there's the remdesivir, which is tablets. Do you do injectable first, then pills, only injectable, only pills? So I'm going to say that as current, yes, like it looks like the 82 days that's basing off of the UC Davis kind of studies, that prolonged treatment course. But I think once we get more experience with these drugs directly, then we're going to have a little bit better understanding and kind of what is the best approach for some of those cats. So it's a great question, and I'll say that give me 6 months, I'll have a way better answer. Hopefully, I'll have these drugs in my clinic too, so it'll be good.
All right, so our next question comes from Misty. I cleared coronavirus from my cattery using Mutinex for 6 days for all cats. Protocol was in a study with Dr. Pedersen and authorized by Dr. Addy. Is the illegality of the drug the reason that the vet industry would not advocate for this with breeders, or is there concern about drug resistance, i.e., saving the drug for cats who have developed FIP?
So I've heard both arguments, and the challenge certainly when I make drug recommendations or therapy recommendations is legitimate sourcing and legal sourcing. Like that is a huge stumbling block. As it is right now, if I do want to pursue FIP treatment in cats, then it's been reaching out towards the FIP warrior groups, and some of these drugs are being sourced like from China and other places. So kind of like it's a little bit of, it's a cat person. It's hard to give up control over cases, and having that faith in drugs. I don't know necessarily where they are sourced, but at the same time, I don't want to lose these patients, and I have seen some absolute miracles happen from them. So it's interesting. I have seen. I did have a Bengal that we did pursue on wet form FIP treatment. Interestingly, her PCR, she was a shedder for coronavirus, and on subsequent retesting, she is now free from shed. So I certainly can see the antiviral drugs potentially having that ability to clear virus on these kind of constant shedders. As to whether it's prudent use or not, I think it's still a little bit of an unknown landscape. Are these drugs, because I think drug resistance is going to be a big problem, especially in the case of remdesivir, where it is a human antiviral drug. If there is perceived, I think, abuse among the veterinary community or overuse among the veterinary community, then we might not have that drug available. So yeah, I think it's again, I know it's a very kind of wishy-washy answer in that sense, but yes, I do think the drugs will cause fecal or will resolve fecal shedding, and access. I think we do, like as a veterinarian, I do be very mindful of prudent use, because the last thing I want to lose this tool, lose this amazing cure.
All right. Misty also asked, what do you think about using accelerated hydrogen peroxide as a household disinfectant?
I love it. That's what we use here. So it's yeah. How's that for a very easy answer? My only comment is that I noticed that these are all are my countertops is they do get a little bit bleach worn over like our I guess it's not technically bleach, but they do fade over time. So and I mean we're disinfecting a lot with a lot of the peroxide here. So I the concentrate I think will kind of damage clothing in that, but in the dilute forms for regular disinfection, it's wonderful. But yes, I have noticed it causing a little bit more kind of a wear on my countertops, but it doesn't mean I'm going to stop using it for that reason.
All right. So Yuki asked, what is the dosage of probiotics for kittens?
So that's a great question. So probiotic dosing is itself is a little bit of an unknown. Is it half a yogurt, 3 yogurts to help your tummy out? In the case of people, so usually with kittens, it's like with the if I'm using Fortiflora, I'll use like 1 pouch for an adult cat, and usually half a pouch for kind of like my minimum for a kitten. In the case of say multi-cat households, so let's say we have a new kitten coming into a household, and I'll just have owners split like 1 pouch between say 2 cats. So usually I'll go as low as half a pouch. The problem or the challenge we have with probiotics is we don't actually know how much of the bacteria needs to be within the digestive system to have that benefit. So in the case of Fortiflora, we can say this is how many colony forming units there are. This gives us that positive response. We know at this dose it works. I don't think anyone's ever kind of said how low can you go on the CFUs to still see a positive response. But my argument is that given kittens are about half an adult cat, that I'm usually fine with splitting a half pouch. And since usually in my practice, there's usually more than one cat there anyway, then 4 to 4 for everybody. So everyone should have some probiotic love. So
All right. So our next question is from Caroline. Does giving lysine daily eventually lead to a reduced immune system or loss of efficiency?
So I want to say no, and I do have some cats that have been lysine responders and they like the taste of it, so they get that full dose in there. It's the nature of what lysine does, and so that's kind of where I like lysine and probiotics are pretty magical because all lysine does is kind of like slows down that virus. So if I'm not actively having a herpes virus exposure, then it's just like taking an amino acid or protein powder. But it is not in itself when we think of conventional like resistancy or drug resistancy because it's not a drug in that sense. And as far as I'm aware, the virus can't outsmart it because it's manipulation of amino acids within that virus replication pathway. It's not like the virus is going to figure out, haha, too much lysine, we'll use something other than arginine in this pathway to make our cell. Like it's just not how they kind of work in that sense. And then as for your question about long-term lysine and the immune system, I guess my first instinct is to say no, because it is in that sense of myself, eating healthy, taking my supplements, ensuring like good nutrition, or I'm doing everything I can to improve my immune system function. But so no, I don't think it'll kind of cause long-term immunosuppression if that's how I'm reading the question right or hearing the question right.
Okay. Caroline also asked, while feline 4 vaccine, which is included feline chlamydia, is not part of the core vaccine routine in Canada as it is in Europe, do you think vaccinating the breeders for it, especially males, when they might get in contact with females from another cattery, would help reduce a lot of cases if it happened?
It's a great question. I would say that yeah, like I have certainly reached for the 4-way vaccine with the chlamydia in the past, especially if the normal PureVax that I use, if the 3-way, the RCP is back ordered. Um, Even though it's not a core vaccine, I think in that category setting where there is so much beyond your control in terms of what like introducing toms, other queens, cat shows, like you can't control what everyone else is doing protocol wise. So to protect your cats, then in that sense, a chlamydial vaccine is very minimal risk and can have great benefit. So I have no hesitation if that's what you wish to do.
Okay, so our next question from Muriel, can Tritric cause abortion of a queen?
I want That's a good question because you're absolutely right. Trichomonas fetus in cattle is a known abortive pathogen. And my first instinct is to say, no, I've never come across that in any of the notes I have read. But I certainly can follow up with Sarah on that question. So, yes, known abortive pathogen in cattle, but no, as far as I know, it is not in cats.
Okay, so the next is from Vera. What is the best way of disinfecting in catteries, and what routine disinfection do you recommend?
So so routine disinfection, so it's using like so if you're having guests or people coming in, obviously like routine hand washing, it's like even soap water, I like a little bit of dilute bleach, although I do appreciate like the some cats with the chlorination smell. It's uh that's usually my go-to for my gross children is a little bit of dilute bleach in my dishwater and washing the counters down with that to reduce infectious load within my own home. In the clinic setting, we do use the hydrogen peroxide, the accelerated hydrogen peroxides. Just being aware of the dilution factors, just because it is non-toxic for exposure. So from a WHMIS or OSHA kind of health guidelines, that way I really don't have a huge preference, just like a good disinfectant. I think even like Mr. Clean Pine Sols, they all have like if they have label claims for basic kind of viral disinfection, they're going to work well. It's going to be picking ones like some cats are very scent sensitive, so that's one of the reasons why I probably do try and avoid some of those like Pine Sol, Mr. Cleans, just because of the scent aspect to cats. Similar ideas like with some of the chlorines, the ammonias, some of the cats again, it's how the cats are so scent sensitive. So I want to be very mindful that whatever I pick as a disinfectant agent is also very respectful of their noses and their respiratory tracts as well. So even though I say dilute bleach is an amazing disinfectant, I certainly don't use it routinely within my exam rooms because I don't need the cats to be kind of irritated by the chlorine, the bleach smell to it. So for my Ruelle accelerated hydrogen peroxides, I kind of go to balancing good disinfection and minimizing smells. But don't
Oh,
underestimate soap and water and hot water.
all right, so the next question from Valerie. Fee, LV, FIV SNAP tests are not offered by my vet, yet I know many jurisdictions do. Why do you think my vet is resistant to perform these tests routinely? I do many PCRs with the clinic, but they seem to question the value of the Fee, LV, FIV tests.
Oh gosh, that's like a minefield question, isn't it? I don't know. So hearing Dr. Susan Little speak recently about Luke, her comment was this was more in a shelter perspective. If a shelter doesn't do routine SNAP testing from an adoptability perspective, it's if we're vaccinating, how the kind of viruses work. Like it was not a deal breaker in her world. I truly don't know. I mean, it's as part of when we have sick cats, fecal FIV testing is kind of considered part of our minimum database. And certainly any new cat coming into a home, we want to screen. I want to know your retroviral status. I realize there are some pitfalls with the regressive progressive on the fecal side and timing of testing with uh, kind of false negatives in that sense. But yeah, I really don't know because I think it is very important for us to be screening these cats. So I guess I'll say to you there, if your vet has questions about SNAP testing for Feline FIV, they can pass the message their name on to Sarah, or they can contact me directly and I can kind of help troubleshoot or find out what their questions are because I don't know. Like to me, it's part of a minimum database, so we should know everyone's retroviral status. And
All right.
kudos for doing all those PCRs.
So Vera asked, you said about immune system genetics. Can it be tested, and do you see any relevance with DNA diversity?
So, oh gosh, now this is going to really stretch me back to some my immunology in vet school. So it talks about the IHC complexes. So it's just kind of like our immune system does come from our genetic makeup. As far as I know, it's not really an area that we can kind of test for. I always kind of was discussing it more in that sense that in the case of FIP, if let's say one Tom Queen pairing always seems to have kittens that do develop FIP, then there is something within that genetic combination. It's the immune system is just not strong enough to clear the infection, leading to that mutation, leading to the FIP kind of forming. But as far as I know, there is no way that we can genetically test kind of what your immune system is. I don't even know if they do that necessarily in people. You probably can. There's a lot of genetic testing you can do in people right now. But yeah, as far as I know, we don't know how to kind of test for that.
All right, so our next question from Yuki. When queens get rhino when she just gave birth, what is the best we can do to help the kittens to have a better chance of survival and lowering the chances of getting infected?
So the first thing we're going to do is start before she even gets pregnant, which is make sure she is vaccinated so that she has a strong immune response to pass on to those kids, so they do have a high level of maternal immunity. Again, then in that kind of peripartum period of time, minimizing queen stress. With the kittens, it's usually when they're a few weeks old when we're seeing maternal antibodies waning. But if we were to vaccinate them, we don't quite have enough time for the vaccine systems to the vaccines to be as effective. It's like that little golden window of not enough maternal antibody to fend off herpes in the cat, but just enough to kind of neutralize my vaccine so that we can't generate an immune response on their own. So it's just kind of focusing on minimizing her shed. So we can use probiotics, we can use lysine, we can use them together too. We can boost her immune system and try and slow down the virus replication within her system. Would I think be the best kind of approach to it. And then just figuring out what works for that queen from a husbandry perspective to minimize her stress. From nesting boxes, resources, other kind of cats, other kind of things in her environment to minimize her stress.
All right, so our next question is from Valerie. Is it possible for another webinar dealing with mycoplasma, which we all know is very challenging to eradicate?
Yeah, I know. I'm always happy to talk. I love sharing cat knowledge. My one kind of, I guess, comment I'll throw out there with mycoplasmas and chlamydia, just when you are managing it, is for me, it's the need to treat those cats with systemic antibiotics. So mycoplasmas and chlamydia are intracellular bacterial pathogens, and they have a really good ability to kind of go deeper within those tissues when they feel threatened. So we have like the eye form of mycoplasmas, and I'm reaching for those, say, erythromycin eye ointments. That's not going to be enough to kind of get any hope of clearance. Azithromycin is kind of my go-to. There has been a paper shown to that azithromycin concentrates high enough in tear film, so I know I will kind of hopefully knock out that ocular chlamydia and mycoplasma. Now, that said, I have one case of perceived treatment failure for mycoplasma, so there we can see bacterial resistance on our antibiotics with those ones, which is very, very frustrating. But I think if you are suspecting mycoplasma or chlamydia, the biggest advice there is that we do have to treat these cats systemically and for an adequate period of time, because they can go intracellular and outwit us that way if we're just using topicals.
All right, so next is from Angela. In trying to provide a calm environment for kings and queens with any virus, are essential oils, vaporizers a good idea?
So one of the challenges I'll say with any diffusers, essential oils, is cats. I want to say it's the phenols within the essential oils. So cats are just more susceptible to essential oil toxicity for their relative weight, size, and how their livers are made. So I think whenever we do use essential oils, we want to approach them with a lot of caution. So here I do have a diffuser. I do have my little sage essential oils that I love to reach for. I pretty much use those away from a cat just to try and help improve the zen of the clinic. As you can imagine, sometimes we get a little bit of stress diarrhea in here or other kind of gross tomcat smells or pee smells. So it's just to try and help more for the human aesthetics of the sense to make everything kind of feel better. If I want to kind of grow that root, then looking at the pheromones. So I know Feel Away is the kind of the big one there. So if we think about pheromones, we have kind of like territorial appeasement pheromones. We also have pheromones that allow me to like other cats. It's kind of like two big groupings of pheromones. So like your feel away classic was facial pheromone force. The more a cat cheek rubs, the happier they are in the environment. The happier they are, the more they cheek rub. So that's kind of creating that territorial neutrality. The feel away friends is a mammary pheromone. So again, when those kittens are with that mom, and that's that pheromone released in that state of nursing to make them like their litter mates, like other cats. So pheromones would be kind of the only thing I can think of, or the only kind of like diffusory type product that I would kind of reach for. With the essential oils, yeah, I don't know if I would risk the toxicity potentially on the liver, depending on how much exposure they're getting to those phenols. So I'd want to reach over with a lot of caution.
All right. And Vera asks, what is the proper vet response if a client reports adverse reaction to the vaccine? Do vets have any protocol in Canada for such situation?
So there's, I guess I could say there's not a standardized protocol. So in my practice, I want to know every vaccine response that happens. So we're always calling the next day to make sure everyone get home okay. Any vaccine worries, depending on the severity of the response, we're also going to report that information to our pharmacovigilance and report back to the manufacturers as well. So, like that vaccine response is a much like ourselves, like a little bit of tenderness at the vaccine site is not unexpected. But if you are febrile, swollen, any more severe responses, we want to know that. And if we look at any of the reported data on vaccine responses, so everything from the most horrific vaccine site sarcomas all the way to tenderness of the site, those numbers are generated because we're reporting that information. So I can say from my practice that, yeah, I don't want to know every cat that's had any kind of vaccine response. It doesn't mean that the vaccine response is bad. I really had to train my brain. It's not a reaction. It is that response when we are giving vaccines, a response to the body. They're saying, whoa, this is foreign, got to make some antibodies. It's not necessarily, I'll say, a bad thing per se, in the sense that at least the body is realizing it has to do something about what was given. But we do want that pharmacovigilance data, because that's how we know whether the vaccines we're using are safe. Is it a bad lot? Any kind of worries that way, we look for those trends and patterns.
All right. Karen asks, how do you decipher between herpes, chlamydia virus, etc., and mycoplasma in cattery kittens? Are there specific symptoms that would help determine each virus bacteria? Aside from testing, of course, how does treatment differ?
So that's a great question. So if I think about herpes, so herpes in the kind of active form is that really, I think of that insanely watery eye. So crazy amount of ocular discharge, usually clear, sometimes brown or crusting, relatively minimal conjunctivitis. Then usually sneezing is our clinical sign. So if we have that cat that comes in, that's almost like that chronically tearing, watery eye, but not necessarily a lot of inflammation of the conjunctiva, that I'm like, whew, someone's having a herpes flare up. And I'll kind of tend to go in that direction. Mycoplasmas and chlamydia tend to really be more ocular in my world. And this is where we really have almost this exaggerated, severe conjunctivitis. Like in some cases, those membranes are cherry red, they're bulging. I might not even see the eyeball. It is so swollen. And typically for me, that discharge is much more that thick mucopurulent, so yellow green, but quite thick. And I would argue it's the idea of like a little bit of a discharge relative to that degree of conjunctivitis. And so that's kind of what I'd be like leaning towards, a mycoplasma or a chlamydial kind of diagnosis. Herpes can have nasal forms, so nasal discharges, again, I'm leaning towards more of a herpes with the sneezing. Corneal ulcers are typically going to be more of a herpes. Mycoplasmas and chlamydia, despite their severity, don't really cause an ulceration. Neither group usually causes fever, so that might not be a very good guideline for me. So I really based off of the inflammation and the nature of the discharge. Unilateral versus bilateral isn't necessarily something I look at. I know some veterinarians might. And then kind of based on that presumption, so if I see that have the hallmarks of chlamydial or mycoplasmas, I'm going to treat them the exact same way, which is, like I said, usually we need a systemic antibiotic. So I like azithromycin. It's once a day. That's why it's my go-to. I know doxycycline is quite popular among my colleagues as well. Uh, in theory, fluoroquinolones, but I don't really reach for those in young kittens, so it's not kind of one of my go-tos, at least from a mycoplasma perspective. But it's kind of like I'll group them into those two. So chlamydias and mycoplasmas, I'm going to treat you guys the exact same. Herpes, I treat very differently. And then so I kind of rarely do PCR testing, at least on the upper respiratory pathogens, unless I'm not seeing resolution. We have an owner that really kind of wants to pursue that testing because it's and been treated the exact same way.
All right, that's going to be it tonight for questions. It's been a really great session. Just wanted to highlight some of the thank yous to Dr. Liz. Olga said, thank you so much. Muriel said, thank you very much. It was a very interesting webinar. Caroline also said, thank you very much for all the information and take care. Thank you so much, Dr. Liz, and everyone for joining us tonight and participating.
Yes, I would just like to say that as well. Thank you for giving up. Time is a very precious commodity. I fully appreciate that. So thank you for giving up your Tuesday evenings to come listen to me ramble on about infectious diseases in cats. It was a blast. I hope, I said there's that take-home message came through, and yeah, it's they said it's I never judge if it's herpes or coronavirus. Try trick, maybe I'll judge a bit more, but no, we're always like this. Work with your veterinarians. We're always here just to help improve the lives of those cats and those kittens. I want those amazing lifelong companions. So it's good. So thank you for attending.
All right. Thanks so much, Dr. Liz. And everybody have a good night.